many years declaring drought in the country a national disaster. Not the first time, but this is what it looks like in terms of numbers. Those in need of food assistance is at 2.1 million. And according to the Red Cross, this is an increase. It was actually 1.4 million that needed this assistance in March. And this is, of course, these 2.1 million people are spanning across various counties. But all of this is due to failed rainy seasons of the year. That is the two. That is the March to May season and the October to December, which has been predicted by Kenya's Met Department to be below par. And of course, like we said, it is those 2.1 million Kenyans are across 12 counties that are affected. And that number of counties, by the way, was 9. Now the number is 12, prompting President Uhuru Kenyatta to declare a national disaster. So let's talk about these 2.1 million of our fellow Kenyans across 12 counties of the 47 in this country to understand just what the situational analysis is. And we thank you, Dr. Asha Mohammed, who's the Secretary General of the Kenya Red Cross Society, for joining us. So, Dr. you've been out, intervening, not just now that we're starting to hear about this. Yeah. Tell us about that intervention, how long it's been, and your situational analysis of this situation. Yeah.
So I think I can say as early as February this year, the Kenya Red Cross has been on the ground because I would say, fortunately for us, we work within communities and we have a network of volunteers in all these 47 counties. And so we already begin to see the changing environment and also people getting into distress. So we started to intervene. And then, of course, based on the assessments that were done and the reports that were released by NDMA, then, of course, it became also very clear that there were people that were actually going through a challenging time. And as you said, yes, the numbers have been increasing. And we find that actually most of these counties are these counties in the semi-arid and arid lands, which are counties, I would say, that are already going through a lot of other vulnerabilities. So even as much as we talk about the failed rains, I would add that actually this food insecurity is also exacerbated by, for example, we had the desert locust invasion in some of these counties. We had even, some flash floods in the same counties, and we also have had conflict. So insecurity has also contributed. So you can see there's also a myriad of other factors, not to speak about COVID, that a lot of people have lost their livelihoods as well because of COVID. And I think this is, the situation is dire, both for human beings, but also for livestock.
And thanks for pointing out the multiplicity of issues, that are at play in these 12 counties. So, when we say these 2.1 million people are affected, what are their immediate needs?
So the first thing is actually food, because a lot of these communities, as you know, of course, are pastoralists. So which means that their mainstay, of course, is the livestock. And unfortunately, the livestock is affected, quite a lot of deaths of livestock, but also water. And water, I would say, is going to be a big challenge in terms of for human consumption, but also for the animals. And the situation is quite bad. It's also causing a sort of a congregation of people as well at some of these few water sources that are available. So the issue of conflict as well is something we need to watch that could rise because people are fighting for the little resources that are available.
Yeah, and so you said you've been, on the ground intervening, since February. Tell us what sort of assistance you've given the people this far.
So we've done some food distribution. We've also given some cash transfer because we actually believe in more of the cash way of intervening. But you realize that some of these communities, actually, there are no markets nearby. So when there are no markets, the immediate thing to do is actually to give food in kind. But preferably, we would go for cash. So we've given cash, especially where markets are available, because it also has another effect, which means that you can support the economy to actually continue. But we've also supported in terms of water. especially trying to rehabilitate, because we have quite a lot of water facilities that only just need some little rehabilitation for them to be functional. Some probably just need a solar system installed because they're running on diesel 24 hours, 7 days a week, and they're breaking down. So those are some of the interventions we've had, but also health. Because as you realize, then when the population is not having enough to eat, especially children, so malnutrition is increasing, diseases, are stepping in. So we have had some mobile health outreaches to ensure then that some of the people who actually need medical services and cannot get to the health facilities are able to actually get help.
And so now the president has declared this a national disaster. What does this mean for you, who's been on the ground? And is this something that gives you hope? We saw this happening, I believe, in a couple of years ago, 2017, I believe, when there was hundreds of millions of dollars that were then, sort of focused on this issue. But what for you does that declaration mean, and what does it do, at least for the 2.1 million people who need it?
For us, it's a very important declaration, and it is one that we have been advocating with other partners to say we need to do this, because the number of 2.1 million, if you actually try to break that down a little, you'll realize like almost 1.6 come from 10 counties. So this is almost 30% of the population of these 10 counties. These are a lot of people. And we are saying these are the ones at this moment. And already we've been told that the next rainy season, October, November, December, is going to be below normal. So this number is likely to increase. So declaring international disaster means that we lift it and make it a national priority. And I think this for us is really important, because it also means that we come together as a nation and coordinate better. We already have a multi-sector committee that has been set up by government, which is already working. We have been privileged to be in this meeting to see how we also support government, because as auxiliary to government, we contribute in this way. But also in terms of prioritizing and looking for the resources. And today you had the president saying 2 billion should be put for this response, which I think is a welcome move. And then there's also the question of support from other partners. For example, for us as Kenya Red Cross, we also get a lot of our support from our international Red Cross partners. And when it is not in this level, then it's very difficult for them to come forward. But we can already see since yesterday, when the president declared it a national disaster, many partners are calling and are saying, what do you need? Can we talk about how we can support? So I think it gives it that impetus, it gives it that push, but it also mobilizes people together and makes it a priority. And I think it's good for the people that are affected, but it's good for even the ones that, could likely fall into the same category. It means we can be able to prevent many more people falling in this.
My final question is, this is not the first time, this is a perennial issue that we've seen. What does sustainability look like, so that we're not having declaration after declaration of national disaster in these regions? It happens at just about the same time. The National Drought Management Authority will give us, forecasts, and so will the Met Department. What does sustainability look like to enable these people have the dignity to be able to carry on with their livelihoods and not look like they're needing assistance year after year?
First of all, I must also just add on to what you're saying by saying that for sure we are not over yet with this, and we have enough information now that climate change is here with us. We've seen it's taken as many years from one drought to another. The time frame is shortening. The number of people that are affected is increasing. The severity of the impact is also increasing. So we will for sure expect to have another drought. We can't do much about it happening because it's a natural phenomena. But yes, we have to start looking for longer term solutions. It's not enough to keep giving food aid. It's not enough even to keep giving the cash transfer. How do we make these communities a bit more resilient? How do we ensure that we are doing more in terms of anticipatory action, even when the weatherman gives us this information, even when NDMA releases the information? What do we do? Do we wait until, because one of the questions, of course, we keep getting is how many people have died? And I said one death is one too many. We don't need to get there.